couple of questions that have come in, which will take a few minutes. So I'm going to ask you 3 questions sort of all together. So our audience would like to know why early menses is a risk factor. And then secondly, if you start a premenopausal woman on tamoxifen and she becomes postmenopausal, what do you do? And are you concerned about using these medicines in the current COVID pandemic?
Good questions. So in regards to the first question with early menses, so there's a lot of data that both early menses and late menopause increase a woman's lifetime risk of breast cancer. And the reason for that is they're exposed to more estrogen with regular menstrual cycles. So if you start your first period at 10 as opposed to someone else who maybe starts at 15, that means that you have 5 more additional years of menstruating. In regards to the second question was, if you start tamoxifen when a woman is premenopausal and they become postmenopausal, we typically will just continue with tamoxifen if they're tolerable, if the medication's tolerable. And we can switch to aromatase inhibitor. So you can do tamoxifen for 3 years and aromatase inhibitor for 2 years if you want to do that. But in general, I tend to just do 5 years of tamoxifen. And I think the last question was about these medications in regards to COVID. So that's actually a great question. So, there's some data that COVID increases the risk of, blood clots if someone has one of those infections. We are very comfortable with patients starting these medications and taking them, even though we're in the middle of this crazy pandemic. We just tell people that if you were to get COVID and you are sick, you can stop the medication during that period. And so that may be stopping for 2 weeks, maybe stopping for 4 weeks. I also tell people if they're planning to do a lot of travel with a long haul flight, which also increases the clot risk, I would have them stop tamoxifen over that period. So if you're doing a 2-hour flight and then you're going to be in the airport for 2 hours before doing another 3-hour flight, you're fine with continuing tamoxifen. But if you're flying to New Zealand or Hong Kong, where there's going to be a continuous flight where you're in the air for 8 or more hours, I would recommend stopping tamoxifen before the trip and not resuming it until after you land. So I usually say stopping it for like 3 to 5 days. And usually when people stop it and restart, they're able to adjust pretty quickly. It is similar to like taking a thyroid supplement because it's an anti-estrogen. It affects the hormonal axis. But overall, I find that people can easily stop and start if they need to.
Great.
The other situation where I would maybe stop tamoxifen is if people were planning to have some type of surgery, whether that's like a knee replacement or hip replacement, an orthopedic surgery that's going to affect their ambulatory status, because both being sedentary, whether you have a joint injury or a joint replacement, that increases the clot risk too. So sometimes, for example, people who are on these medications may stop tamoxifen for 2 to 4 weeks because they need to have a knee surgery.
Great. So a couple of other things. There was a question about if you have dense breasts as well as a high-risk lesion, does that further increase your risk? And that's a great question, and one that we are trying to learn more about. It appears that if you have LCIS and extremely dense breasts, again, so the category 4, that you may have a higher risk than someone with LCIS who doesn't have extremely dense breasts, but that the data on that is still evolving. And so again, these are very personalized assessments. So not everyone with LCIS will have dense breasts, and not everyone with dense breasts will have LCIS. So we want to try to look at each individual woman's risk factors. Also, the question was, well, how much does early menses increase risk? And it's really difficult to to tweeze out these different hormonal factors as far as what is their absolute magnitude on risk. So it's early menses and late menopause, which means that you go through menopause later in life than maybe your average woman. And so that, again, as Dr. Bychkovsky said, that increases your overall estrogen exposure over the lifetime. And that's why those factors are important. But we really can't say that early menses increases it by, 1% or 2%. We don't have that type of granular data because that's not the only risk factor, right? All of these things are factored together. And then just real quickly, Brittany, if you start taking tamoxifen and you're taking it for about 2 months and you don't have any symptoms, no side effects, are you in the clear?
You mean for having side effects?
Yes, you don't have any hot flashes after 2 months. Do you have to worry about getting hot flashes?
I would say you're probably in the clear. Usually people, if they're going to have hot flashes or these vasomotor symptoms with tamoxifen, it happens in the first 2 weeks. I do tell people that if you do have hot flashes, sometimes they go away within 4 weeks. So there is this, observation that people will notice new symptoms, but like their body kind of adjusts. So I tell people when you start these medications, really try to take it for, 4 to maybe 8 weeks. And see if you can adjust. Like sometimes women will come back and tell me that they had a little bit of a headache, but by the time they took the medication for a week, that went away. So I do tell people if, for example, they have a headache or any other symptoms that begin when they started, give it a little time because it may be just your body adjusting to the medication. In regards to the clot risk, that is there for the duration of therapy. So if you start tamoxifen and you don't have a blood clot in the first 2 weeks, there's still that risk for the duration of the therapy. But I do tell people just be informed of what are the symptoms of a blood clot in the legs. Usually it's unilateral pain, swelling, those types of things. And if that were to happen, to call us. If it comes up on the weekend, go to your local urgent care, get an ultrasound, explain to the team that you're on tamoxifen and you're worried about a blood clot. And those types of things can be pretty quickly evaluated and sorted out.
Great. So we want to highlight that those are rare. So the serious side effects are rare.
Very rare, less than 1%. Like we're talking about 0.4, 0.5%.